Good morning. Today I am reviewing a patient 4 months after she underwent PRASAD treatment in my practice. Last week she came to me with some recurrence of pain below her knee joint. I did a blood test for metabolic assessment. I'm glad to say that everything is normal. Then I diagnosed the condition as infrapatellar fat pad syndrome, which basically means that there is a pad of fat here below the kneecap, and that was painful. So I diagnosed it, and then I sent her for some non-surgical treatment like taping and exercises, and she has done that, and now she has come back today. So I'm going to show you the test, and I will point out where she was having the pain. This is the knee joint, this is the kneecap. She was having the pain in this region, Okay, so here. So now I'm squeezing the fat pad between the patellar tendon. I'm going to ask her to lift it up. Lift it up. Are you having any pain now? No pain. Earlier she had pain. Again she lifted up. She's not having pain. So the diagnosis of this condition is mainly by clinical examination. This test is known as Hoffa's test. And the treatment here, you can see some evidence. You can see that there is evidence of tape here. This taping has been done. First treatment is, the reason why it is hurting is that this fat pad here is getting pinched and the knee becomes straight. So the solution is to decrease the pressure on the fat pad by taping the patella, so that when I press the patella down or the kneecap down, it lifts up and there is more room in this area. You can see now, if I press down, the kneecap goes up and there is more space here, and the fat pad will be relieved. So this is the taping method. In addition to taping, there are other exercises which can be done. So she is already wearing high heels, shoe elevation of about 5 to 10 millimeter is sufficient for that. She's already doing it without my saying so. And then there are detailed exercises. This is a conservative treatment. First we start with taping. If needed, laser therapy, and then exercises to strengthen the hip abductors. I've taught her that, and to stretch the quadriceps muscle. This is the treatment of Hoffa's fat pad syndrome. So if all this fails, the condition is mainly due to a disturbance of the fat pad here, this fat pad, it is very sensitive to pain, and it is usually involved in metabolic type of osteoarthritis. If these conservative measures fail, then the other treatments are orthobiologic treatments, starting with PRP, bone marrow, and my PRASAD treatment. PRASAD stands for platelet-rich adipose-stromal advanced derivative. So the fat pad over here becomes inflamed and fibrotic. So to treat that, we are treating it with like fat here, fat from outside. So that will reset the joint like you reset your phone, and provide a biological stimulus to this area, and patients will respond to it. This is done under ultrasound guidance. So in summary, we have talked about Hoffa's fat pad syndrome and how it is treated with PRASAD. We talked about fat pad syndrome, Hoffa's fat pad syndrome. I've showed you the tests. I've showed you what treatments are done conservatively. What is the diagnostic test? MRI is the diagnostic test, gold standard. Ultrasound can be done, and the treatment, if conservative fails, is PRP, bone marrow, and PRASAD or adipose-stromal treatment. Thanks for watching. If you or some of your relatives have this pain, this this condition can be confused with runner's knee, meniscal injuries and all that. If they complain of pain in the front of the knee, then refer this video to them and let them gain knowledge. My website is given below. I'll see you in the next video.